And so I'll show you some results comparing those who receive emergency financial assistance to those in the control group who don't receive either of those services. So that's the structure of the experiment. Let me show you what we find after 6 semesters. So when you look after 6 semesters, this is the fall 2013 cohort, the outcome, the graph on the left shows you whether or not the students are still enrolled in any college 6 semesters later. And so what you see is amongst the stay the course participants, nearly half are still enrolled in a community college or 4-year college 6 semesters after enrollment in the program. Is that a high rate or a low rate? The only really way to know that is to compare it to a group of people who didn't receive the services, so the control group or comparison group. And what we see is the group that was not invited to participate in Stay the Course at all, were still enrolled at about 24%. That difference between the treatment and control suggests a doubling of enrollment rates when you compare the treatment group to the control group. So in other words, the Stay the Course program has led to a doubling of enrollment rates over 6 semesters. Ultimately, we don't want them to stay in school forever. The goal of the program is to generate degree completion. So we looked at what fraction of the treatment group and control group have completed a degree 6 semesters after initial enrollment. And what you see is a substantially larger fraction of the Stay the Course participants have obtained a degree as compared to the relevant treatment group, the relevant control group. Now, a natural question here is, are there certain groups that benefit more from Stay the Course than other groups? And so we looked across a number of different domains. We looked by gender, by race, by initial credit hours, by the number of entry examinations that they had passed. And when we looked across those groups, one particular subgroup stood out more than any of the others. And that was the effect of Stay the Course for females. So what you see here are the results for females in the fall 2013 cohort, where you see that they, like the overall group, have about amongst the Stay the Course participants, have about half of them are still enrolled in school. But compared to the relevant comparison group, this is a much larger effect. So their females that participate in Stay the Course are 36 percentage points more likely to still be enrolled in school 6 semesters after enrollment in the program than the comparison group. So that's really a very large and, as we say in kind of the impact evaluation world, a statistically significant effect of this program for females. If again, ultimately what we care about is whether or not they graduate, and we're seeing this very large pronounced effect for females 6 semesters after being enrolled in the program. And so this is about as solid evidence as one could hope for on the impact of a program. We're finding for females here, this is a large effect, and as I'll show you shortly, a persistent effect. So I mentioned earlier that we enrolled 2 different treatment groups. All the results I've just showed you are for students who have participated in the full Stay the Course program as compared to a group that doesn't receive any additional services beyond the status quo that the community college offers. What I want to share with you now are how do the results look when we compare those who were offered just emergency financial assistance as compared to students who didn't receive any additional services. And so these are the main results for that. So on the left, you see the blue or the purplish bar is the enrollment rates for students that participate. It's really participate in the emergency financial assistance only component of Stay the Course. And so they were at about 50%, but with the relevant comparison group, was only a little bit lower than that. So the difference between the treatment group and comparison group for the emergency financial assistance part of the study is quite small when looking at enrollment rates. And on the right, if you look at degree completion rates, the fraction that have earned an associate's degree, you actually see that the comparison group has received a degree at a slightly higher rate than the group that was invited to have access to emergency financial assistance. Together, what these results indicate is that we're not really getting much bite on offering emergency financial assistance in terms of either increased enrollment rates or increased degree attainment. The kind of early takeaway on this is that you can't get the same benefits in terms of better academic outcomes by providing just emergency financial assistance. Rather, emergency financial assistance coupled with the case management services provided by the navigators in the Stay the Course program are really what's moving the needle for this particular group. The results I've shared with you to this point are all for 6 semesters after degree completion, and we've written this up in a longer academic paper that we'd be happy to make available to anybody who's interested. That's available online. We have also recently gotten data on these same study participants 8 semesters afterwards. And so the question is, do the results that we find after 6 semesters persist further on, so 4 years after enrollment? And this is important to consider because one thing you might be concerned about is that what Stay the Course does is just move people to the finish line faster, and the comparison group would eventually catch up. And if that's the case, that's important to know in terms of what is the ultimate cost benefit. Or alternatively, this could have a more sustained effect, and maybe the comparison group never really catches up to the control group. So we looked at the data 8 semesters after initial enrollment, and here's what we find in terms of earned an associate's degree. And so you still see this large pronounced difference between the fraction of those who participate in Stay the Course who have earned an associate's degree as compared to those in the comparison group. So this difference is a little bit smaller than what I showed you before, but so there's a little bit of catch up, but overall we still see that the number is much larger for the Stay the Course participants. When you look at the females on associate degree completion, what we see is that very similar to the results I showed you after 6 semesters. So this really doesn't provide any evidence that the comparison group is catching up. They're just obtaining their degrees one year later. So this is really promising evidence that there is this persistent effect of Stay the Course on the margin of obtaining a associate's degree. Now, this evidence points to the program effectively moving the needle on key outcomes for this vulnerable population. But an important question that one wants to ask when doing a more broad assessment of this program and the appropriateness of scaling it up and replicating it elsewhere is the question of, is this investment worth it? So we're getting what appears to be a high return, but this is also admittedly a more expensive program. And so the question is the return high enough to justify the additional investment? And so what we did is conduct a cost-benefit analysis to compare the costs of providing these services to the long-run benefits that one would expect to receive from the improvement in outcomes. So let me make a couple of comments about this cost benefit. So Catholic Charities Fort Worth provided a lot of information on how much it costs for them to provide this program, at least for this initial cohort. The providing all of the services, the emergency financial assistance, the cost of the navigators, the cost of the management and supervision of those navigators, when averaged out across the students in the program, it was about $1,900 a year per student. So if thinking about a student who receives services over the course of 3 years in the program, it's about $5,600. And then the question becomes, is it worth it to invest $5,600 per student over 3 years in order to get the increase in associate degree attainment that we're finding? And so what we did to answer that question is we looked at national data on what is the returns to getting an associate's degree as compared to attending community college but not getting an associate's degree. And so you can think about this as how much of an earnings boost does a participant in state of the course expect to have if they are to complete their associate's degree. And what those data show is that on average, there's an earnings boost of about $1,300 per year. And so you can think about this as the economic gains from your obtaining an associate's degree as a result of participating in this program. And at those numbers, what this indicates is that within 5 years, so at about 4.25 years, we've already obtained an increase in earnings that fully offsets the investment in the program. So the break even would occur at about 4.25 years of being in the workforce after completing your degree. And this is pretty promising on a cost benefit side, because keep in mind that this is the only metric on the benefit side we're using is the increase in earnings. There are many other benefits one might expect to obtain from obtaining an associate's degree. Those include, Corinne showed you some numbers earlier about lower unemployment rates, so higher employment stability, also higher rates of attendance at four-year colleges. Eventually, this leads to greater educational attainment at the bachelor's level, et cetera. There might be many other benefits that we're not measuring, but looking at earnings alone, we show that over a reasonable time frame, the participants in this program are benefiting from earnings boosts that more than offset the cost of the program. So that's kind of a quick summary of the results. I look forward to answering any kind of questions that people might have. But before I kind of turn it over to the Q&A, I wanted to talk a little bit about from our perspective, following up on some of the comments that Corinne made about what it's like to be enrolling and launching a program that has a randomized controlled trial evaluation attached to it. And one of some of the points that I wanted to hit on were, well, how do you manage these results with key stakeholders? And so I've kind of really separated these comments into two groups. One is the internal stakeholders. So this is the staff overseeing the program and the leadership of the agency that have to communicate what's going on, both in terms of the program and in terms of the findings. And then I want to talk about some external stakeholders like fundraisers, funders and foundations and benefactors. So when thinking about it internally, an important concern anytime you have an impact evaluation is that staff can get apprehensive about the fact that this program is being put under the microscope, and oftentimes can be viewed as a high stakes assessment, and that if the program isn't shown to work, that means, or if the results aren't what they hoped to be, that means that the resources might be allocated away from the program. And we work quite a bit to try and communicate these results in a way that it's not a high stakes assessment. Really, what we view this as is an opportunity to learn what works, what doesn't work, and for what groups does the program work, which provides the staff an opportunity, and the leadership of the agency, an opportunity to really learn about how to effectively allocate their resources in an efficient way so that they can really drive improvements in the outcomes for the clients that they are targeting to serve. And so really we think of this as an opportunity for continuous learning and improvement of their program. And just to give an example of that, when we, early on, when we were evaluating this, I showed in my timeline that we had results at 2 semesters, 4 semesters, and 6 semesters after enrollment. So after those 2 semester results, we had really promising evidence that much higher enrollment rates for the treatment group than the control group. But then when we looked beyond 2 semesters, the results, enrollment rates for the control group started to move towards those of the treatment group. In other words, the impact of the program diminished a fair amount. And we talked with the program staff about this and presented these results, not as necessarily the program isn't working, but let's explore what's changed, what has happened after 2 semesters as compared to 4 semesters. And this really fostered a healthy conversation within the agency about exploring their case notes and other information they had gathered on the implementation of the program. And one of the things that they uncovered was significant less engagement between the student participants and their navigators over time. And this led to a redesign in many respects, or just kind of at least a setting of some hard targets on the engagement level between the case managers, those navigators, and the students. And we're still trying to kind of tease out what are the factors that are leading to the improvement in outcomes within the program, but it does appear that this engagement does seem to have play an important role. So I view that as an important lesson and a takeaway from this opportunity to get evidence along the way of the impact of the program. I also want to kind of build off a point that Corinne made earlier about the interest that external stakeholders have in this evidence. And there is a bit of a management challenge here as well, because when you have an external funder who knows that you're running an impact evaluation like this, they want to see, or they're asking about results all the time. A program like this where you need students to obtain, ultimately you want students to obtain an associate's degree. You want to look at least 2 years after enrollment before you really start to put too much stake in the evidence that you're finding. But we have found that the message of communicating the stories and frontline experience that the folks at Catholic Charities Fort Worth can communicate, along with the evidence, the hard evidence of the impact of the program, has resonated tremendously with these external stakeholders. After about a year into the program, I went down to Fort Worth and presented the early findings together with the Catholic Charities Fort Worth team to a large group of foundations and stakeholders. And one of the results of those meetings was a foundation that had significant interest in expanding this and made the investment to scale up the program so that we could continue to follow these students and to expand the program to an additional campus at Tarrant County College. And so we really feel like that it strengthens the story that you can tell if you have this kind of solid evidence to back up the stories of the impact of the program. And so the question might be, well, where do we go from here? And this program really from the beginning was designed not just to be a program for Tarrant County College. Catholic Charities Fort Worth has thought a bit about how they want to scale this program up. We started with a program in a very local community. So it was launched in Tarrant County College, or in Tarrant County, at Tarrant County College. But the design was to use the information and the lessons learned here to scale this up to programs all across the country. So I'll just briefly mention that Catholic Charities Fort Worth has launched an initiative to replicate this program in communities across the country. And they have, they recently launched an RFP. They've received all the applications for 2018, but let me just talk a little bit about the replication plans for Stay the Course. Over the next 4 years, they'd love to launch Stay the Course in up to 6 sites, and their plan is to do 1 site in 2018. And they've worked a lot on preserving the fidelity of this program. So they've collected a lot of materials and refined this model so that when it's replicated, we know that the program that's implemented elsewhere is essentially the same Stay the Course program as is being implemented in Fort Worth, Texas. And they've provided a lot of materials and put together a lot of materials to make this possible. And one of the things they've done is put together a series of materials that you can navigate through via a website so that it facilitates the getting an external agency up to speed for how to implement Stay the Course in their local community. But beyond that, Catholic Charities Fort Worth has put together a program of technical assistance and training to help agencies get up to speed on how to implement this program. And when the program is launched in these other sites, there'll be a fair amount of quality assurance and monitoring to make sure that the program is being implemented in the way it was designed, and provide opportunities for when obstacles arise that the program can be amended to address those issues. Because not every community is going to have different issues. The issues that students encounter in Fort Worth, Texas may not be the same issues that are encountered elsewhere. So there's an understanding that the program may be modified in other communities. And in each of these cases where we're replicating at a different site, we are working to incorporate the impact evaluation so that we can continue to monitor and assess the effects of this program to verify that the promising evidence that we're finding in Tarrant County College can be found elsewhere. And with that, let me turn it over to you all so I'll ask for questions. And so it looks like we have a number of questions, and I can't promise we'll get through all of them, but I'll take them I'll try and take them in order. And let me start with the first question from Anupa Fabian. What did the communication between the service providers, research, and evaluation unit within Catholic Charities and LEO look like? Was there a key point of contact in a research evaluation role in Catholic Charities who served as a liaison between LEO and the service providers? Corinne, do you want to, because I'm happy to describe that, but maybe since we have you on the line as well, you want to talk about it from your perspective?
Sure. So when Stay the Course first launched in 2013, there was not a sort of dedicated role to focus on that, sort of bridging the gap between the service providers and the researchers. However, we learned sort of quickly that the program manager didn't have the capacity to be able to do that and to focus on the intervention at the same time. And so we simultaneously had launched a separate project, also in collaboration with LEO. And actually, I myself was brought on to serve in that role for this other project called the Padua Pilot. And we quickly learned that really did help. It allowed the service providers to focus on the services, and it allowed kind of me and my team in our role to focus on the data sharing components and the randomization and just the kind of research relationship and language. And we found that really beneficial. So we ended up adding a role for Stay the Course that was serving in the same function. And I don't know about you, Jim, but I think overall it's really kind of helped us to stay on track from a service provision standpoint, but also to really build up a great relationship between the practitioners and the researchers.
Yes, I agree. And I think it's really helpful to have someone at the agency whose job is not to, besides the person running the program, who can facilitate the communications between the researchers and those implementing the program. And so Corinne actually serves that role, takes the lead on that role for Catholic Charities Fort Worth, and that has certainly helped in terms of not just making sure that the information we're conveying gets to the right folks at Catholic Charities Fort Worth, but also that it's conveyed in a way that doesn't increase apprehension, or that they understand the results in the context which is appropriate. So just in the interest of time, let me move on to another question. Was this intervention already established showing fidelity or before it was rigorously evaluated. This was actually a brand new program designed by Catholic Charities Fort Worth in collaboration with Leo. But it really is based on a lot of information and research that was done on existing programs across the country, and also based on kind of a needs assessment that Catholic Charities Fort Worth had done at the time. I will say that there are very similar, there are similar programs out there across the country. The ASAP program is one that also has been evaluated that shows promising results as well. But also our concerns about it being a new program, one thing that we did to address that was to when we launched it at a new campus, we saw that as kind of the phase 2 evaluation. We incorporated some lessons learned, and we're now tracking those outcomes over time. So we look forward to seeing whether or not the same promising results are evident as we have expanded the program and incorporated lessons learned. Another question by Stephanie Lynn was, I'm curious whether participants had input on the study, and if so, how was it sought and integrated? How are results being communicated back to study participants? So I'll make a general statement, and Corinne, maybe you can comment if whether or not information is being communicated to those who are actually enrolled in Stay the Course. But there's been very little after enrollment, very little interaction with the control group, although they're aware that this program is launched on campus. And I will say that we also have had a qualitative researcher on this project who have observed navigator-student interactions and also done an assessment on kind of from her perspective what and based on interviews of students and interviews of the program managers, what appears to be working and what is not working. And that information has been, we provide kind of like a continuous feedback loop with the provider so that they can learn from that information as well as just the quantitative results. Corinne, do you want to add anything?
Sure. So we haven't gone as far as to do a participatory action model, but we do seek feedback from students, as we're able to, particularly if they decide to leave the program before they've completed their degree. We'll ask them to complete an exit interview, and they have the option to do that with somebody besides their case manager or navigator if they choose. And then, as Jim mentioned, in between sort of different cohorts, we've made some slight modifications to the program over time. And whenever we do that, we make sure that we're getting feedback from students to help inform that. But again, the feedback loop is more informal than formal. So when we do receive results and things like that, there are some students who will sometimes be asked to participate in panels or events with some of our stakeholders at a completely voluntary basis. And so if they're a part of that, they'll typically hear about the program at large. But it's not, again, a terribly formal feedback loop with the students themselves.
Great. So I'm really excited about the number of questions. So I'm going to apologize in advance. We won't be able to get to all of them. I will say that if you want to follow up, feel free to. We'll give you some contact information at the end, and you can provide those questions, and we can follow up offline. But Peter Samuelson asks, do you need to get permission to collect data on control group members? So I guess the short answer is no. The FERPA legislation that provides the guidelines for the sharing of student level information has an exemption for research purposes. We at the research team never sees the actual student IDs. They are linked externally to this outcome by the community college. So we get information about the control group without knowing who the actual students are specifically. There are some limitations with whether or not we can share this information or link this information to other external sources. So for example, we're planning to link these data to information on earnings. And so, one of the ways that we have addressed the concerns about linking information for the control group is in subsequent cohorts, we have asked the students who participate in the study to complete an enrollment process before we enroll them in the program. And in that case, all of the students are consenting not only to be part of the program and part of the study, but that their information would be linked to administrative sources. Let me do one more question is there evidence of deferred earnings for stay the course participants while they are in school? If so, how large is that cost? So that's from Bill Sermons. We don't have evidence on that right now. Catholic Charities Fort Worth might have some information on amongst their participants, but what I can tell you is that we will be able to answer this question. I think it's really important. The idea is that, there's an additional cost of going to community college because you can't work perhaps as much while you are in school. I will say that a large fraction of our study participants are working outside of going to school. And but in the future, when we link to administrative data on earnings, we'll be able to go back and answer that question as what is the earnings loss while you are in school. And with that, I'm going to turn it over to Andrea to wrap things up.
As we come up on time, I would like to thank Jim Sullivan and Corinne Weaver for joining us to share with the Leo community their experience on conducting an impact evaluation and the results on the Stay the Course study. This has been a great discussion. As Leo works to build evidence-based solutions to poverty, having someone, especially like Corinne, share key insights from the process of conducting an impact evaluation with Leo is invaluable. We also want to thank everyone who participated in Leo's webinar on best practices for evaluation today. We will be following up with information about how to access the webinar recording and slides. Finally, if you are interested in partnering with Leo on an evidence-building project, please feel free to reach out to Wendy Bureno, whose contact information is on screen, for an introductory call. If you are interested in opportunities to participate in replication of Stay the Course, you can contact Natalie Jacobs at Catholic Charities Fort Worth, whose contact information is also on screen. We thank you for joining us and hope you have a great rest of the day.